Hi, my name's Kelly Forbes, Senior Mental Health Practitioner with Newry and District GP Federation. So you'll have seen we're doing a big bit of information on women's health, and originally when I started looking at perimenopause and menopause, you can't really look at that end without looking the whole of a woman's journey throughout her life. So the research of Dr. Mosconi at the moment has been very powerful. She is linking really into the brain changes that happen for women in their key periods of life. So puberty, pregnancy, if a woman chooses that path, and then perimenopause, menopause. So she has seen through her brain imaging work that at each of these key points there is a pruning and a rewiring process that happens that can be seen at the outside. Women come out with a new set of skills at the end of that stage in life, but the process can see a set of vulnerabilities, which I guess we think about as symptoms. So thinking about puberty, the brain at this point, it kind of prunes, and then it has a big rewire from kind of a girl's time in life, from puberty right through to kind of the early 20s. We see this mismatch in brain development where the emotional side of the brain is developing far more quickly than the logical side of the brain. So we're seeing this impulsivity, this recklessness, the high level of mood changes, and then the logical part just it isn't quite there yet. And we also see a massive surge in a girl's ability to show empathy. And then by the time she hits around 21, early 20s, she's then got a whole new set of life skills to be able to go into early adulthood with. But the changes in that time cause risks, and we know the figures that are for girls around that time, that along with their monthly cycles, the risk of anxiety, depression and eating disorders are 2 for 1 in favour of females compared to males at a similar age. So moving on to the period brain, which is the fluctuation of hormones that have impacts on the brain throughout the month. So again, Dr. Mosconi with her brain scans, at the start of the month, so week 1, week 2 of a woman's cycle, high levels of estrogen up in the brain, and you can actually see the brain cells visibly connecting more. So the logical and the emotional part are much more stronger, and then as the month goes on, you can just see the brain connections happening a little bit less, which would then explain the woman's irritability, sleep, all of those changes that she would report on. So then moving on to pregnancy, if that's a choice that a woman makes, Dr. Mosconi has shown that this is probably the largest period of pruning and rewiring for a woman at this point. So even from the point of pregnancy, huge changes happening in the brain in terms of oxytocin and big levels of hormones happening. And then we have this period of 1 to 2 years postpartum. So the rewiring is huge levels of empathy, this kind of, she calls it this like mama bear GPS tracker system where you're always able to like locate your child, and this huge increase in the empathy part of the brain, which again, that mum experience of am I the only one that knows how to do things around here? It's because those parts of the brain that can almost anticipate needs before they even arise are so much switched on. She also talks around women that are, mothers, the level of solution focused and multitasking and problem solving that's done on a day-to-day basis is pretty phenomenal. She calls it the supermum brain. But as with puberty, pregnancy, it also kind of comes with its risks. So the rewiring, again, you get great skills as a mum, but a lot of women are getting the baby blues and the mood changes, and for some this can progress into this postnatal depression and anxiety. So the final change that we have then is the perimenopause and the menopause. So again, Dr. Mosconi, she's showing us the changes that are happening to the brain. And she says, again, we've got this pruning and this rewiring, because she says that the skills that you need as maybe a working mum, you don't need that in later life. So again, that pruning and rewiring is happening. But as with the other stages, that rewiring comes at a cost. So pop over to our video on symptoms of perimenopause and menopause to look more at that.